Do you trust them if one of them is the Republican Party's nominee and potentially the next president of the United States to repeal this law?
The biggest thing we have to do is elect a president. I think Newt's right. The problem is that two of the people up here would be very difficult to elect on, I think, the most important issue that this country is dealing with right now, which is the robbing of our freedom because of Obamacare. Governor Romney tells a very nice story about what his plan is now. It wasn't his plan when he was in a position to do a plan. When he was governor of Massachusetts, he put forth Romneycare, which was not a bottom-up free market system. It was a government-run healthcare system that was the basis of Obamacare, and it has been an abject failure, and he has stood by it. He stood by the fact that it's $8 billion more expensive than under the current law. He stood by the fact that Massachusetts has the highest health insurance premiums of any state in the country. It is 27% more expensive than the average state in the country. Doctors, if you're in the Massachusetts healthcare system, over 50% of the doctors now are not seeing new patients. Primary care doctors are not seeing new patients. Those who do get to see a patient are waiting 44 days on average for the care. It is an abject disaster. He's standing by it, and he's going to have to run against a president. He's going to have to run against a president who's going to say, well, look at what you did for Massachusetts, and you're the one criticizing me for what I've done. I used your model for it. And then we have Speaker Gingrich, who has been for an individual mandate, not back when the time that just was heritage was floating around in the 90s, but as late as comments since 2008, just a few years ago. He stood up and said that either should have an individual mandate or post a $150,000 bond. How many $150,000 bondholders do we have here who can post a bond for their health insurance? These are two folks who don't present the clear contrast that I do, who was the author of Health Savings Accounts, which is the primary basis of every single conservative reform of health care. I was the author of it back in 1991 and 92, 20 years ago. I've been fighting for health reform, private sector, bottom up, the way America works best for 20 years. Well, these two guys were playing footsies with the left.
I want to bring Congressman Paul, I'll bring you into the discussion in just a moment, but Senator Santorum directly